today is Veterans Day. It's a day we take to honor those who've served in the U.S. Armed Forces, though we do honor them and keep them in our minds each and every day. Tomorrow, the New York State Department of Veterans Services and Mountainside Treatment Center is featuring a panel discussion on veteran recovery and mental health. Part of that event will include screening some of the upcoming film, Between Wars. It stars Emmy Award winner Michael Imperioli from The Sopranos. He plays Sarge, a combat veteran turned therapist.
We get it, right? Nobody understands when we try to explain it. They didn't experience it, we did, so be it. But the truth is, owning it, facing the dragon, slaying the dragon, because if the dragon wins, and we gotta pay the price, right?
After my recovery, I began blacking out from the hatred and the rage. My unit and I, we were sweeping a building, and I ran smack dab into a Taliban. It was like two alley cats going at it, you know, screaming and screeching and clawing.
That was a bit from the upcoming film Between Wars. It stars Emmy Award winner Michael Imperioli from The Sopranos, set for nationwide release on streaming platforms in January of next year. Joining us now in the Bloomberg Interactive Brokers studio is Keith Appleton, Director of Veteran Clinical Programming at Mountainside Treatment Center. It provides treatment for alcohol and drug addiction, as well as Dr. Lessie Branch, Special Assistant for Community Engagement at the New York State Department of Veteran Services. First, both of you are veterans. We thank you today and each day for your service. Dr. Branch, you were in the Navy and U.S. Navy Reserves. Keith, you served in the Army. Dr. Branch, I want to start with you. What does Veterans Day mean to you?
Well, Veterans Day means to me, and first off, thank you for welcoming us, and happy Veterans Day and Veterans Month to all who have served. Veterans Day means to me the time where a grateful nation should say thank you to those who have served, who have raised their right hand and sacrificed for all of the freedoms that we all enjoy today. And so, you know, not just today, but every day, every month. If not for those who raised their right hand to serve, we wouldn't enjoy the freedoms that we enjoy today.
And I have to say, Keith, come on in as well. You know, brother in the Navy, uncle in the Navy, dad in the Army. Like I feel like we all have lots of family members at some point that participated in the military. What does Veterans Day mean to you?
Yeah, I mean, it was beautifully said. I would also just add to that too, just the kind of the point that you're making, that also I think families are important to be recognized. Yeah. Because it is the soldier that goes in. However, the whole family signs up for it as well. And it's a sacrifice that they have to make.
I was just watching something, forgive me, but it was talking about like when a lot of vets came home from World War II, like we didn't have an understanding of the impact on their mental well-being. We didn't really have a society set up for it. We had some movies that touched upon it and so on and so forth. But what's the reality? And I want to bring in the movie, like how all of this came together to kind of shed some light. Keith, why don't you pick it up?
Absolutely. So just kind of responding to a couple points there. The World War II piece, that's a really good point. In the 90s, we actually saw an influx of World War II veterans, the prior war veterans, who had not gotten treatment, flooding into the VA, which created kind of this crisis moment where we didn't have enough staff to serve all of them. And that's where we really needed that private care, that community-based care. And essentially, we're so excited here to be partnering with New York State Veterans Services Department so that we could build those connections and really be able to provide that care on a community basis, care that veterans need.
Do we have enough providers of that care now, Dr. Branch?
Well, that's a really good question. And what I can say is that at New York State Department of Veterans Services, we are taking a highways and hedges approach. We are out in community, seeing what the resources are, partnering with community-based organizations, state agencies, federal agencies, to leverage the assets in service to those who have served. And I'd like to say also, the stigma on mental health is now lifting. And that is a good thing because it is now helping the veteran who has been socialized during their time in service to not put self first, but to put mission first and always. And so there are lots of things that the veteran would face in service that they just wouldn't talk about because they've been socialized to not. So thankfully, the stigma is lifting around mental health, and community is being educated as well to help the veteran.
Dr. Branch, what's particular, though, about someone who has served potentially in a very difficult, a conflict situation that is unlike anything? We all talk about stress and things that test all of us, certainly in our everyday life, but being in a military situation where there's, weapons and people and death potentially all around you, of those that you consider the enemy and also those that you consider, part of your, troop unit. How is that unlike anything else and requires something very unique and special for those individuals who come home and are impacted?
That's a great question. And there is no offer on switch, right? But it seems that is the expectation. And to your point, veterans are asked to do things that the average civilian would never encounter or experience. And then to come back home and be expected to just resume life as you once knew it, as normal, is a challenge because there are things called triggers that can yank you back to a time of conflict, right? And so, again, because there is now the stigma that is lifting around mental health, and veterans are being encouraged to come forward to talk about, right? Community is where this is at. And so not just for the veteran, but for community, there's a responsibility that community bears for helping the veteran heal.
Keith, on that, the private sector, companies that veterans end up going and working for, what role do they play in all this?
I think so. As far as the roles that they play, it's really us coming together at every level throughout various organizations, connecting with state, federal resources, but also, going out to the vet centers, going out to the VFWs, connecting with, Wounded Warrior Project is something that we're looking into, but really just trying to get out there, get connected, and be able to have those resources available. Because in my practice, I see veterans coming in and either not knowing what resources are available.
Well, how do you connect with the veterans who don't know that they would benefit from speaking with someone like you?
So I think this is where we've done a really good job, and this piece of the stigma that we were talking about, I think a way that we're starting to really kind of turn the course with that is by bridging veteran to veteran contact in whatever way that looks like. So for us, we use a veteran service navigator in our program, and that is somebody who meets with the veteran initially on the spot, starts introducing them to all the resources that are available, and also is that continued support to be able to translate that military language for the veteran to what they need to do on the outside.
Where's the responsibility of the federal government in all of this? I just think, for those that risk their lives for the safety of all Americans around the world, I think many would argue and say there's a responsibility of all of us. We pay taxes, that we should make sure that there is money that goes to those individuals who are impacted in that service. So where is that?
So if you think about it, there's 18 million veterans right now in the U.S. population. Now, 9 million of them are connected to VA or VSO services. However, that doesn't mean that they're all using the resources that are available, and there's still that significant gap. So one thing we recognize is that 1 in 3 veterans live 40 miles or more away from their closest VA or VSO service, which again just reflects, the community mission, the community-based mission, and also the privatized mission, and being able to connect on the outside of these state and federal organizations. I think we all owe it to the veterans to do that.
Dr. Branch, if you could change one thing that would help these veterans, what would it be?
Dignity. I would offer that treating the veteran with dignity, not assuming the voice of the veteran. A lot of times people see a veteran and a whole picture crops up in their head about who the veteran is. If someone saw me on the street, they would never think that I'm a veteran. The fastest growing demographic of veteran happens to be women. So not assuming the voice of the veteran, dignity, but also cultural competence in terms of military or cultural humility. People think they know, right? And it's okay to think, but making the assumptions, as we know, sometimes has people ending up looking like something that they don't want to. So
applies to so much, actually.
Right. So
in
take
society.
the time to get to understand and know and speak to a veteran. Veterans' lived experience as policy expertise.
And just last thought, this film, Keith, that you guys are going to use in screening, and I always do think there's something that culture, whether through the arts, can teach us so much. What do you hope that people take away from this film?
Really kind of what we're talking about here. It is that veteran to veteran connection that kind of bridges that gap to open up those lines of communication, to get past the stigma and start getting on a healing path and recovery. And at Mountainside Treatment Center, that's exactly what we do. We actually started a veteran recovery support group that's free every Wednesday, 6:30 to 7:30. All a veteran has to do is click from anywhere in the United States, and they're in the group with a veteran clinician and a veteran recovery coach.